This is WFYI News Now. It's July 29th, and I'm Abriana Herron. On today's show, Republican gubernatorial candidate Mike Braun's plan to make major changes to the state's property tax system, an effort to help students explore a potential career in the healthcare industry. And some kids with sickle cell disease miss out on fun experiences like overnight summer camp. We have a feature story about one camp in Indiana that's trying to change that.
I had a friend that cut me off because they thought sickle cell was contagious, which kind of hurt me.
Those stories coming up, but first, nearly half of Indiana college students graduated on time in 2023, according to new data from the Indiana Commission for Higher Education. From WFYI's Education Desk, Dylan Pierce-McCoy reports this is the latest modest increase in the number of Hoosiers who successfully earned degrees.
The number of Indiana public college students who graduate on time has been slowly climbing over the past several years. Community colleges have made particular gains. About 24% of students who started in 2021 got degrees within 2 years. That may seem low, but it's actually a huge jump from a decade earlier, when less than 5% of Indiana community college students graduated on time. The increase is important because Indiana needs more educated workers. The state has seen a decline in the number of high school graduates enrolling in college, and improving outcomes for students who do enroll is another way the state can educate more Hoosiers. I'm Dylan Pierce-McCoy.
Republican gubernatorial candidate Mike Braun has unveiled a plan that makes major changes to the state's property tax system. Indiana Public Broadcasting's Brandon Smith reports Braun says nothing is more important than controlling costs so that homeowners can stay in their homes.
Braun's plan makes significant changes to the homestead deduction, and the bottom line is, for a $200,000 home at a 2% property tax rate, you'd save $224 this year under his proposal. Going forward, the plan would also cap property tax bill increases at 2% for older homeowners, low-income Hoosiers, and families with children under age 18, and at 3% for everyone else. Property taxes fund local governments and schools, not the state, and the Braun campaign won't say how those lost dollars would be replaced. It says it hopes his plan starts a conversation around delivering effective government services without allowing budget creep and overburdening homeowners. For Indiana Public Broadcasting, I'm Brandon Smith at the State House.
Democratic gubernatorial candidate Jennifer McCormick says Braun voted to increase property tax bills in the past and accuses him of saying anything to get elected. Libertarian Donald Rainwater says Braun's plan only reduces increasing tax bills and doesn't stop the increases entirely. A new statewide resource is aimed at giving students an interactive experience to explore career pathways in the healthcare industry, which is among Indiana's top employment sectors. Indiana Public Broadcasting's Tamoria Cunningham reports the creators of the new program say educating students about healthcare careers is important for the future of the industry.
The Healthcare Begins With Me campaign launched its career awareness website earlier this summer. The site features interactive games to learn about different occupations, an area to further research jobs in the industry, and resources for educators. Rick Ferrin is with Northeast Indiana Works, one of the workforce development organizations behind the campaign.
It's imperative that we ensure the sector is adequately fueled with talent for many years to come. So it was an important sector. We needed to develop strategies that would make sure that the workforce in healthcare was robust.
The website is part of a larger workforce campaign by the Northeast Indiana Healthcare Consortium and is funded through a state grant to establish and expand career pathways for Hoosiers. For more information, you can visit healthcare.beginswith.me. For Indiana Public Broadcasting, I'm Tamoria Cunningham.
And for our final story today, children who have sickle cell disease are at a higher risk of mental health problems. That's because the genetic blood disorder impacts the body in many ways. For example, some children experience delayed puberty, which may lead to social problems and even bullying. The disease is also so unpredictable and can send them in and out of the hospital. It's why some kids with sickle cell disease miss out on fun, immersive experiences like overnight summer camp. Side Effects Public Media's Elizabeth Gabriel reports on one camp in Indiana that's trying to change that.
Camp Silvermoon is a week-long summer camp in North Webster, Indiana. It's one of less than 50 summer camps across the country for kids with sickle cell disease, a genetic blood disorder. Kids here do tubing, sports, and participate in talent shows.
Sam, you're out.
Some sickle cell patients get tired more easily or can't handle as much physical activity. This is 13-year-old Jordan Rohde's 5th year at camp. He feels like everyone here gets what it means to have sickle cell, unlike some people at school.
I had a friend that cut me off because they thought sickle cell was contagious, which kind of hurt me.
Unlike typical summer camps, this one has about 15 extra staff, some with medical experience.
Why is she not wearing her jacket? Sweetheart, no.
Kimber Blackwell is a physician assistant there. She says one of the hallmarks of the disease is pain crises, which can be triggered by different environmental factors.
So it's keeping their cabins warmer at night, making sure they've got a blanket, making sure that they dress in layers.
Sickle cell causes blood cells to become stickier and hard to flow through the body. That can lead to strokes, organ damage, and extreme pain that can last for days. It's why camp staff remind the kids to drink a lot of water. It helps the sickle cells move through their body.
So make sure you guys bring your water bottles everywhere with you guys, okay? If you guys do forget your water bottle, make sure you guys let me know, okay?
Rohde hung out with friends and played a little bit of kickball on the first day of camp. Then, a sickle cell pain crisis hit.
Here, grab my hand. All right, good job.
Staff used walkie-talkies to call for a golf cart so he could go to the infirmary.
Just the left side? All right. You don't have to stand up on your arm.
The pain was so bad, Rohde cried during the roughly 10 steps to the golf cart.
Okay. All right. Okay. Keep your bad one off the ground and just use this one. Yep. Okay.
Nurses swiftly gave Rohde water, a little snack, and some pain medication. Things could have been a lot worse if it weren't for the preparations at the camp. In fact, most sickle cell patients in the U.S. struggle to access proper care because there aren't enough medical professionals who know how to treat them. Louis Sue is a pediatric hematologist with the University of Illinois, Chicago. He hopes there are more camps, but he says staffing and funding are big barriers.
If you have children from low-income families or families whose resources have already been depleted because of medical costs, then you can't really charge them. So you have to figure out how to raise that money.
Back at camp, Rohde started feeling better about an hour later.
Okay, on a scale of like 1 to 10, how did the pain feel then, and then how does it feel now?
It was an 8.5. Now it feels a solid 3.
Good. I like that. Do you think you'll feel good enough to go back out today and do stuff? Or are you not sure?
Not at all. I'm going to take the rest of the day off. I'm not going to do nothing because that can trigger it more.
Rohde left camp 2 days early, but he says he'll be back. In fact, he says he wants to be a counselor in a few years.
I just want to make sure the next group that comes here, I can show them a good example.
He says because he has sickle cell, he would understand how they feel and get them the help they need. Elizabeth Gabriel, Side Effects Public Media.
That's all for today's episode of WFYI News Now. Our podcast is produced by Drew Daudelin with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music, and I'm your host, Abriana Herron. If you like today's episode, remember to subscribe and share. And follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.